Your eyes can tell a story about your health that you can't see just by looking in the mirror. And here's what most people don't know. The very first sign of diabetes might not be in your blood. It might be in your eyes. Hi, I'm Dr. Ryan Westbrook, and in this video, I'm going to show you what diabetes looks like before it becomes obvious. Because the truth is, your eyes are like a window into what's happening in your entire body, and understanding what to look for could literally save your vision. Diabetes is one of the most common conditions I see in my practice, but here's the frustrating part. Millions of people have diabetes right now, and they have absolutely no idea. Think about it. You feel fine. You have energy. You go about your day. But inside your body, high blood sugar is silently damaging your blood vessels. And your eyes are incredibly vulnerable because they have some of the smallest blood vessels in your entire body. So when diabetes starts, one of the first places it shows up is in your eyes. Let me be clear about something. I'm not trying to scare you. I'm trying to inform you, because awareness changes everything. If you know what to look for, you can catch this early. And catching it early can mean the difference between keeping your vision and losing it. So here's what actually happens in your eyes when blood sugar stays high. Your eye has a part called the retina. Think of the retina like the film in an old camera. It's the light-sensitive tissue at the back of your eye that actually captures the images you see. The retina depends on tiny blood vessels to bring it oxygen and nutrients. When blood sugar gets elevated and stays elevated, these blood vessels start to get damaged. We call this diabetic retinopathy. Now, this doesn't happen overnight. This is a process that can take months or even years. And here's what makes it so dangerous. In the early stages, you feel nothing. You see nothing. The damage is happening silently in the back of your eye. You're going about your life completely normally, while these microscopic blood vessels are weakening. As the blood sugar damage continues, these tiny vessels start to leak. Fluid seeps out into the retina. That's when your vision might start to get a little blurry. Some people see floaters, which are little specks that seem to float across your vision. But again, these symptoms are easy to ignore. A lot of people think, "Oh, I'm just tired," or "My eyes are just strained from looking at screens all day." They don't connect it to their blood sugar at all. If diabetes stays uncontrolled, it gets worse. The blood vessels can start to bleed into your eye. That's when you might see what looks like a shadow moving across your vision. Or you might notice that suddenly you can't see as clearly as you used to. And if we get to advanced diabetic retinopathy, the retina can actually detach from the back of your eye. That's when you could lose your vision completely. Here's the hopeful part. Your eye doctor can see these changes before you can. They have special equipment. When they dilate your pupils and look at the back of your eye with special lenses, they can see the damage to your blood vessels. They can see the leaking. They can see microaneurysms, which are tiny bulges in these fragile vessels. They can see areas where the blood vessels have closed off completely, depriving the retina of oxygen. This is why regular eye exams are so critical for anyone who has diabetes or who might be at risk for diabetes. It's not just about checking whether you need glasses. A dilated eye exam can literally reveal disease that's happening in your body. And it can give us a chance to act before permanent damage happens. I want to tell you something. I've had patients come to see me and their eyes were already showing significant damage. I asked them, "When was your last eye exam?" And they said, "Oh, I don't need glasses, so I haven't been in a few years." That breaks my heart because so much of that damage could have been prevented if they'd caught it earlier. So what should you actually look for? What are the signs that something might be going on with your blood sugar? This is important, so pay close attention. The first one is blurry vision. Now, a lot of things can cause blurry vision. You might need new glasses. You might be tired. But if your vision is getting progressively blurry, especially if you haven't had an eye exam recently, that's worth investigating. The second sign is difficulty seeing at night. Some of my patients tell me they're having trouble reading, trouble driving at night, trouble seeing the details of things in dim light. This can happen as diabetes damages your retina. Floaters are the third sign. Those little dark spots or specks that seem to move across your visual field. Now, floaters are pretty common and usually not serious. But if you suddenly start seeing a lot of floaters, or if you're seeing them along with some of the other signs I'm mentioning, that's worth getting checked out. The fourth sign is trouble with colors. Your color vision might seem a little washed out, or colors might not look as vibrant as they used to. This is sometimes an early sign that the photoreceptors in your retina are being affected by diabetes. The fifth sign is dark or empty spots in your vision. Imagine looking at something and noticing a blank area, like something is blocking part of your view. That can happen as areas of your retina stop getting enough blood flow. And the sixth sign is what we call metamorphopsia. That's when straight lines look wavy or distorted. If you're looking at a doorway or a straight edge of something and it looks bent or wavy, that's telling you that fluid has accumulated in your macula, which is the central part of your retina. Now, I want to be really clear. Having one of these symptoms doesn't automatically mean you have diabetes, but these are signs that something needs to be checked out. And the only way to know for sure is to see an eye doctor. Here's what I tell my patients. Not everyone gets diabetes, and not everyone with diabetes gets eye damage. But there are certain things that increase your risk significantly, and you should know what they are. The biggest risk factor is how long you've had diabetes and how well controlled your blood sugar is. The longer you've had high blood sugar, the more time these blood vessels have to get damaged. This is why it's so important to get diagnosed early and to keep your blood sugar in a good range. The second major risk factor is your blood pressure. If you have high blood sugar and high blood pressure, your blood vessels are being stressed from two different directions. Your eye blood vessels are especially vulnerable to this combination. The third risk factor is your cholesterol levels. High cholesterol can contribute to damage in your blood vessels, including the vessels in your eyes. The fourth risk factor is pregnancy, if you have diabetes. Something about pregnancy can make diabetic eye disease worse. If you're pregnant and you have diabetes, you need to be seeing an eye doctor regularly throughout your pregnancy. The fifth risk factor is smoking. Smoking damages your blood vessels and makes everything worse. If you smoke and you have diabetes, you're putting yourself at extremely high risk for losing your vision. And finally, being overweight or sedentary increases your risk. When you're more active and at a healthier weight, your blood sugar tends to be better controlled, and your whole cardiovascular system, including your eye blood vessels, stays healthier. So you might be sitting here thinking, okay, Dr. Westbrook, I'm worried. What do I actually do about this? And that's the right question to ask. Because here's the good news. There's a lot you can do. First, get your eyes examined. If you haven't had a dilated eye exam in the past year, schedule one now. If you have diabetes, aim for at least one dilated eye exam every year. If you have signs of diabetic eye disease, you might need to go more frequently. Second, if you have diabetes, or if you're at risk for diabetes, get your blood sugar checked. You might have prediabetes or diabetes and not know it. A simple blood test can tell you. This is one of those situations where knowing your numbers matters. Third, manage your blood sugar. This is the biggest thing you can do. Work with your doctor. If you're overweight, try to lose weight. If you're not active, start moving more. Think about the foods you're eating. Reducing processed foods, eating more vegetables, drinking water instead of sugary drinks. These aren't just good for your weight, they're good for your blood sugar. Fourth, manage your blood pressure. Get it checked regularly. If it's high, work with your doctor on bringing it down. You can do this through lifestyle changes like moving more, eating less salt, and managing stress. Sometimes medication is needed too. Fifth, if you smoke, quit. I know that's easier said than done, but smoking is one of the most damaging things you can do to your blood vessels. If you're trying to quit, talk to your doctor. There are more options to help you succeed than there ever have been before. Sixth, manage your cholesterol. Eat foods that are good for your heart. Limit saturated fats. Eat more fiber. These changes help your whole cardiovascular system, including your eyes. Seventh, stay active. You don't need to run marathons. A brisk walk for 30 minutes most days of the week makes a huge difference. Movement helps regulate your blood sugar and keeps your cardiovascular system healthier. And eighth, manage your stress. I know that sounds simple, but chronic stress keeps your blood sugar elevated. Find what works for you. That might be deep breathing, meditation, time in nature, time with people you love, a hobby you enjoy. Whatever it is, make it a regular part of your life. I want to tell you about a patient. Let's call him John. He came to see me because he was having some blurry vision, and he was concerned. His eye exam revealed that his retina showed signs of early diabetes. His blood sugar was elevated, but his primary care doctor hadn't caught it yet. Because John came in when he did, we caught his blood sugar problem early. He made changes to his lifestyle. He started moving more. He changed his diet. He lost weight. His blood sugar improved. His eye health improved. And we've now gone several years without any progression of his eye disease. Compare that to another patient. Let's call her Maria. Maria also had blurry vision, but she waited a long time to come in. By the time I saw her, her diabetic eye disease was advanced. We had to do laser treatment to try to stop the bleeding in her eye. We had to inject medicine into her eye to reduce the swelling in her macula. And even with all of that, Her vision didn't come back completely. The difference between John and Maria wasn't their genetics. It wasn't their age. It was timing. John caught it early. Maria didn't. And that's why I'm making this video, because I want you to be like John. I want you to catch this early if it's happening. Now, I want you to know that if diabetic eye disease is caught early, we have treatments that can help. Laser treatment can seal off leaking blood vessels and prevent the disease from progressing. Injectable medications can reduce swelling in your retina and help preserve your vision. And surgery can sometimes repair damage that's already happened. But here's what I tell all my patients. The best treatment is prevention. The best medicine is the one you never need to take. If you keep your blood sugar controlled, if you keep your blood pressure controlled, if you keep your cholesterol in a good range, if you stay active, if you don't smoke, you might never need any of these treatments. That's the goal. That's what I want for you. So let me recap what we've talked about today. Your eyes are a window into your overall health. Diabetes damages the small blood vessels in your eyes before you feel any symptoms. Regular eye exams can catch this damage early, sometimes before you've even been diagnosed with diabetes. There are specific signs you can look for, like blurry vision, floaters, trouble seeing at night, and color vision changes. And most importantly, there are things you can do right now to protect your vision. You can manage your blood sugar, manage your blood pressure, keep your cholesterol in a good range, stay active, don't smoke, and get regular eye exams. If you have diabetes, treat it seriously. It's not just about how you feel today, it's about protecting your vision for the rest of your life. And if you don't have diabetes but you're at risk, that's even more reason to make these lifestyle changes now, before disease develops. Your eyes have given you the gift of sight your entire life. They deserve that same level of care and respect. Don't take them for granted. If this video was helpful, please like it and subscribe for more health information. And if you have any questions about your eye health, please see a qualified healthcare provider. Thank you for watching.